If we think back to the beginning of the pandemic, when nobody really knew anything about how that would affect pets and households with people that had COVID, an idea for a study was born to try to understand and try to answer that question.
Hey everyone, thanks so much for joining us for this episode. This one is sponsored by VCA and Antech and features Dr. Jimmy Barr and Dr. Marie Kerl. And the topic of this podcast is related to a study during the, I'm just going to say it, the COVID-19 pandemic. If you're like me, maybe you've built some walls in your brain around those years. I know I really don't like to think about them, but this talk, trust me, is so much more than taking us back to the time of the pandemic. This is a live episode that we recorded at VMX where I got to sit down with Dr. Barr and Dr. Kerl to talk about a study that involved collaboration between Antech and VCA and aimed to answer critical questions about COVID-19 infections in pets.
More specifically, do pets exposed to COVID-19 become infected? And through collaboration and the selfless efforts of researchers and associates, including a number of associates who volunteered their own animals to participate in the study.
Don't worry, none were harmed and all had up-to-date blood work by the end. This team was able to analyze over 1,000 samples and create a clearer picture of how COVID-19 was affecting our furry family members. And while this was important during the pandemic, it also demonstrated the curiosity and the agility of both teams when it comes to getting important research off the ground. This is especially encouraging when we think about how this type of thinking, this type of testing, could provide benefits for public health in the face of emerging diseases. For example, current concerns surrounding HPAI, or highly pathogenic avian influenza. This one is a story of collaboration, dedication, and a shared commitment to the well-being of animals and people alike. Let me tell you about my guests, and we'll go ahead and jump in.
As Chief Medical Officer for Mars Pet Care Science and Diagnostic Division and Antech, Dr. Jimmy Barr, who is board certified in emergency and critical care, oversees the quality organization and leads delivery of medical care for the global Antech veterinary diagnostics business.
Additionally, Dr. Barr serves a key role in connecting science and diagnostics in the Mars pet care ecosystem and the veterinary profession. Most recently, Dr. Barr was Blue Pearl's Chief Medical Officer, a position he held since 2018, growing the clinical affairs team and taking it to new levels of medical leadership and excellence. While serving as CMO of Blue Pearl, Dr. Barr helped establish the Board of Chief Veterinary Medical Officers, which is an important collective of over 60 top veterinary medical leaders from across the profession representing various industry segments. Dr. Barr currently serves as the chair of the Board of Chief Veterinary Medical Officers. Dr. Barr holds undergraduate and veterinary degrees from Louisiana State University and completed his residency in emergency and critical care at Angel Animal Medical Care Center in Boston. He worked clinically at Blue Pearl starting in 2007 and served on the faculty at Texas A&M University before serving in Blue Pearl leadership. Dr. Barr enjoys outdoor activities and woodworking. He's married to another veterinarian, Medora, and has 2 dogs, 2 cats, and 2 human children. And Dr. Kerl oversees medical operations at VCA's network of more than 1,000 small animal veterinary hospitals. She joined the VCA family in 2017 as Regional Medical Director and then later moved into a combined Regional Medical Director, Regional Operations Director role. Prior to her promotion to Chief Medical Officer, Dr. Kerl received her bachelor's degree and Doctor of Veterinary Medicine degrees from Auburn University. Later, she earned her master's in Public Health and MBA from the University of Missouri. She has over 25 years of experience as a diplomate of the American College of Veterinary Internal Medicine with a specialty in small animal internal medicine. In 2001, she became a diplomate of the American College of Emergency and Critical Care. She's also active in veterinary disaster response as a member of the National Veterinary Response Team and the Missouri Volunteer Veterinary Corps. They were great conversation, so wonderful to talk to, so let's go ahead and get into it.
Pet parents are looking for a veterinary practitioner who can prove they understand and support the relationship they have with their pet, show you value your client's trust, and earn an official Human-Animal Bond certification from NAVC and HABRI, the Human-Animal Bond Research Institute. This certification, appropriate for all members of the healthcare team, explores the scientific benefits for veterinary staff, owners, and animals, and discusses how to establish and promote a strong human-animal bond. Enroll today at VetFolio.com.
Dr. Kerl, Dr. Barr, thank you so much for joining me. I love all topics related to One Health. I think they're so important. So I'm really excited to dive into this one.
Yeah.
We really appreciate the invitation.
Yeah, excited to be here.
Yes. Okay, so let's kind of set the stage a little bit as far as this COVID-related study about the incidence of antibodies in our pets. Can you tell us a little bit more about it? Dr. Kerl, I'll hand that over to you.
Yeah, no, I'm happy to jump in on that. And if we think back to the beginning of the pandemic, when nobody really knew anything about how that would affect pets and households with people that had COVID, an idea for a study was born to try to understand and try to answer that question. And our veterinary epidemiologist, Dr. Ann Kimmerlein, worked on with Dr. Christian Lutnager at Antech. And the basic premise of the study was identifying pets in households where people had had COVID and retrieving samples from those pets and being able to measure them for antibodies. And as the study was conducted, we had over 600 VCA associates who volunteered their pets, both dogs and cats. We had over 1,000 samples from dogs and cats in households where people had had COVID at least 2 weeks before, sometimes months before. And interestingly, identified through that 33% of dogs, 25% of cats tested positive for antibodies, even though most of those pets showed no signs of clinical illness. So this was actually an incredibly important study to show that there is an effect, and how in future pandemics can we help to really involve knowledge about pets and interaction with people in those situations.
It's such an interesting idea. Dr. Barr, anything you want to add to that?
Yeah, what I thought was really interesting was the correlation between how close the pets were to the people that had the infections, and the sort of the incidence of those pets having the SARS-CoV-2 virus. I mean, it just highlights to how close our animals are and part of our families now, right? And we classically think about felids being the ones that are sensitive to that can catch and be clinical for the SARS-CoV-2 virus. In this case, it was the dogs that actually had a higher incidence of seroconverting, and so they I thought that was kind of an interesting sort of caveat. Maybe it's because cats live on their own terms and aren't with us all the time, and our dogs are in our bed. I'm not sure.
I was just thinking that you're like
links.
coughing and sneezing. Your cat's like, ew,
yeah,
no.
I'll be over here. Yeah, thank you very much.
That is interesting. Certainly it makes sense from thinking about the effect on felids, especially with respiratory viruses and things like that. And, we were concerned about big cats in zoos and things like that. But I guess just the overall idea for the study, like what prompted, was it primarily based in concern for animal health? Was it, more of an academic endeavor since most of the animals weren't sick? Where did the idea for this study come from?
I think it in those early days where we really knew nothing, and then individual case reports would start to come out that this animal tested positive, and we would have these kind of patchwork of individual animals. The really wonderful thing about this is it showed pets across North America, and it allowed us to really see a much larger scope. As we look at veterinary healthcare and studies in veterinary medicine, we have often identified that we don't have a lot of patients in most of them when you compare with human studies. So this was a way to try to answer in a much broader way and identify what was happening out there when something we didn't know. And truly, we had no idea what we were going to find and how that was going to work out. I am very thankful to work with people who have a lot of scientific curiosity. And there was not an ulterior motive in the beginning. We really just wanted to know what was going to happen. And between the partnership in VCA and Antech, and really motivated people had a way to be able to do that and try to answer that question really broadly.
I think that makes a lot of sense. I know, at least for myself and probably all of us a little bit to a degree, have a little bit of a mental block back in that time period. So
yes,
we
want to block it.
When you say when we really didn't know anything, I'm like, oh yeah, yeah, that makes sense. Absolutely.
Yeah. And clinically we were struggling with that idea of if there's a pet that has respiratory disease, should we isolate it? Should we do all these things? And I think it just highlighted that in this circumstance, yes, they were exposed, but not a lot of them got real sick. We had that question, would cats or dogs be able to spread that to our associates? And so it was a big we were wrestling with that question. Fortunately, all of us were using contact precautions and, and masks and things like that. And so we're already wearing the PPE that we needed to, but it was, just an interesting idea to sort of elucidate that a little bit. And honestly, think about, 1,000 pets. I mean, that's a great sample size in veterinary medicine. I mean, congratulations to Ann and Christian for doing that. It was a great study.
Yeah, that is a great sample size to really get some good data. You've spoken about the findings a little bit already in terms of the incidence of antibodies and things like that. But you've also mentioned that most of the pets didn't get very sick, which I think mirrors a lot of our real life experience. But when you did see animals getting sick, I'm curious, were there any specific findings when it did come to clinical illness or any other, kind of just interesting head scratching findings that came to light?
It's really just mild respiratory signs, mainly in cats. So in the study, we know that dogs had more antibodies, but cats tended to show signs a little bit more frequently. So they were just very mild, kind of nondescript signs. Probably something that most pet owners wouldn't even pick up on, probably.
Okay. So we weren't seeing a lot of really significant clinical illness,
right,
but
exactly.
Despite exposure, I mean, it was there. Did any findings come to light in terms of transmission back to humans, or that was probably beyond what you were looking at with this study?
Yeah, I've never seen any evidence that the transmission can go the other way. So this really is a reverse zoonosis and not something that is zoonotic.
Yeah, and I'm not aware of anyone ever documenting that, from that standpoint, because it's just, it would be difficult to prove, however. I mean, there's also a component of this is longitudinal in nature. We measured the antibodies sometimes, months after, even sometimes up to, I think, a year later. Mm-hmm. And there was, without getting too technical, right? So in an infection, the IgM levels actually go up. So we measured IgM and IgG. The IgM levels go up first, and then IgG sort of takes off after that, right? So there was some evidence of IgM being present long after what we thought was the original exposure, which implies there's a lot more to kind of learn there, which implies repeated exposure, right? So, so maybe they're, the pet parents were sicker than they thought, or someone else,
or somebody else
had it. I mean, that's true. I mean, who knows? But it's just an interesting sort of component of that. And there's a lot yet to learn.
Right. Yes, there is. I'm like, no, but yes, there is.
Yeah.
There is more to learn. When you're talking about the incidence of antibodies and things along these lines, and Dr. Kerl, you mentioned working with a group of people with a great deal of scientific curiosity. Mm-hmm. I'd love to hear both of your thoughts on what this says about the human-animal bond and our relationship with our pets. I'm thinking from the standpoint of, it was important to people to say, yes, test my pet. Like, I want to know this. I want to do the best I can for them as well.
And that is one of the aspects of this study that I also found really heartwarming, I think, of having, I call it community science, and people want to contribute and they want to be involved. Maybe some of them wanted to have free lab work on their pets since there was a perk. It involved them actually collecting the samples and processing them and answering a survey. And so it wasn't without any work or involvement on their part. And they were just very excited to be able to participate and really, really want to know those answers. So that just inspired me and gave me some hope for the future.
Yeah. I mean, it's not easy to bring your cat in to get lab work done, right? So, having 250 cats, I think is, pretty amazing. But, this is a motivated group of, veterinary professionals, right, that wanted to, be a kind of a part of it. These were all VCA associates. And so I'm not surprised. These are people that are naturally curious and chose veterinary medicine as this part of the particular thing. For me, I think what stands out for me is the freedom, that we have to do some amazing things within veterinary medicine, and being able to have both the technical agility to be able to, sort of develop tests like that. I mean, that was a new virus. We had to make that test, so our Dr. Lutnager and our research and development department did that, right? So first of all, made that, but then, being able to bring that to bear and measure that over time is really amazing. And it showed a great collaboration, and, we had that flexibility to be able to discover something. I mean, there's no there's no return on investment on this, right? This is not. This was because we really wanted to know that answer, and we're fortunate to be in a situation in which we can do that. Yeah.
Sure. Can you both talk a little bit more about that collaboration? Because, certainly VCA and Antech, but you're talking about, creating the test and then, of course, we're having to go through the data at the end and find out what all of it means. So I'd love to hear more about just the collaborative aspect.
We, VCA and Antech, have had a historically very long-term, really positive relationship. And that allows us to have free conversations about things. Like it's very easy for me to reach out and find somebody to talk to about something. We actually are collaborating on a couple of other studies right now. When you think about this wealth of data, we have the patient data and know a lot about that side of things. And Antech has the scientific expertise to be able to help to answer those questions. And we both approach this really of how can we give back to the profession and give back to science. This study started as a conversation between Anne and Christian of how do we answer this question and what do we do? And then that led to a study design, and it was a really very organic, seamless process. And I'm very grateful to the relationship that we have and look forward to future endeavors.
Yeah, it's just some of that. Maria and I have had a long-standing relationship for a long time. We're both critical care specialists and have known each other for a long time. But this is sort of deep down within the organization. And what strikes me about this is just the innovation that this takes. You take for granted, we'll just do a test. I mean, the scientific machinery that is needed to actually do that is actually really impressive, and certainly beyond my capabilities, that's for sure. And so, having not just the desire to do it, but matched with the agility to be able to do that in a very short circumstance. I mean, we had, within just a few months of, the outbreak of the pandemic, had the ability to be able to test that, in an acute setting with a PCR, but also, with the, followed very quickly thereafter with antibodies. And so the know-how has to be coupled with the machinery to be able to do it. And that's the part that I'm just amazed at every day. Our industry is so full of, innovators and full of people that can do these things. But, in this circumstance, those two things were mashed together, and I think came up with a great piece of science, a great contribution to what we know about things. And it was novel. So, yeah, congratulations all around. It was a great thing.
That's very cool. Yeah, it speaks to the best of our profession. So that curiosity and that willingness to collaborate and work together to get this information for the benefit of humans and for our pets. Mm-hmm. Absolutely. Yeah. Hopefully this is not, the conversation around the COVID pandemic is not a conversation that we will be repeating with another disease anytime soon. Oh my goodness.
Some wood we can knock on.
I
right
know.
Now.
Do you guys have some out there? We need something. Absolutely. However, what do you feel like, some of the takeaways were from not only this study, but the collaboration as well? Should we be facing, future zoonotic outbreaks, God forbid pandemics in the future?
Yeah, I can take a shot at that. I think, the collaboration together, I mean, communication and collaboration are key in all of these things. And this thing that had happened here is just a small part of how we need to participate in the public health mission together as veterinary professionals, right? So if you think through about what we're facing now with, highly pathogenic avian influenza, that's on everyone's mind, from a standpoint of, what does that mean in the future? We're a few mutations away from that kind of being a problem. And that has a zoonotic potential and a revert. Clearly that's crossing species lines, whether or not that, broadly affects humans. We don't, that's not really known that much yet, but we do know it happens in our patients, and we're seeing it increasingly happening, especially in feline patients. And so we have to communicate as a profession better about those kinds of things and make sure that we have that on our mind, make sure that's something we're thinking about whenever we see a patient that might have the exposure profile that we're sort of looking for. But, there's also lots of things that, that surprise us, which underscores the need to test for things. In the age of, antimicrobial stewardship and all the things that we're sort of thinking about, testing more and treating empirically less, I think is going to help us all in knowing what's happening in the profession.
Absolutely. Yeah, no, that makes a lot of sense. Dr. Kerl, did you want to add anything to that?
Yeah, I just there are so many ways that pets impact public health, and I have an interest. I have an interest in many things, but I have an interest in public health and thinking about that intersection. And Jimmy brought up the highly pathogenic avian influenza, really great example right now that we are seeing that crossover. We can help to educate people. The main exposure right now for cats is raw milk, raw meat, unprocessed and uncooked things. And there are a lot of people in the general public that don't understand the risk and how do you avoid risk. It's in our veterinary oath that we take to try to protect the public health. And this is something that all veterinarians, it doesn't matter your practice area, that there are ways to be engaged and involved in that.
Yes. I'm so glad you brought that up. Yes, that is part of our oath, and it's such a big responsibility.
Mm-hmm.
And to your point, Jimmy, when you're talking about testing
Yep.
and testing more and empirically treating less, I think that's probably even more so when we're talking about emerging pathogens and zoonotic diseases and things like that. So I would love it if you could expand on just the laboratory side of things and the agility that comes on that side.
Yeah, boy, that's a big subject, and I don't know if we could get into all of that today. Yeah, exactly. So, we live in a changing environment, right? We live in a changing world, and knowing what it is that we're shooting towards is exceptionally important, and knowing how those things change over time. You think about vector-borne diseases, for instance. I mean, that and as an example, and if you think about how there are environmental changes when it comes to host geographic patterns and things like that have changed over time, that have been recognized, you've got to have a situation in which you do sort of the analysis of what's going on within the system, and then changing diagnostics so that they match what's going on. Creating a test for SARS-CoV-2 virus is actually one sort of aspect of that, but that also goes into viruses that are there, bacteria and their antimicrobial susceptibilities, all of those things, monitoring and then sort of adapting testing such that you can make good decisions about your patients. We know that there have been changes over time for, tick vectors, and the different tick vectors that are in different geographic areas have different things that they cover, which means that the pets that get exposed to those are going to have different diseases. We know that. And so being able to sort of monitor that and change the diagnostics such that we have some, stay tuned in this area. We have some studies that are coming out that are demonstrating that exactly, and how you adapt the testing to fit that. So from that standpoint, there's a responsibility that we all have in order to be able to do those things. And if you look at all the things that veterinarians need to do, veterinarians play a very important part of that, of sort of identifying those things that sort of go in there. And, veterinary technicians have a point of that. It's extremely important for them to they're the ones that oftentimes are talking to the clients about the importance of testing, the importance of, preventive care and things like that. So, those are the types of things that go, in our mind and from a research perspective, and how we sort of are preparing for the future. Those are things that we think about every day.
Along those lines, talking about the importance of doing lab work on patients and we talked about this 1,000 patient sample size and how great that was, and continuing to generate that data, of course, for the benefit of our individual patients, but getting more of this information as a whole as well. Dr. Kerl, with your expertise, I would love to hear your input on that as well.
I'm very excited about a lot of the diagnostic tools that we have now. I think about the fecal PCR screening that we have now, that we're learning amazing things about zoonoses and parasites. Compared to the diagnostic tests we used for 100 years.
It's a little different.
If it was negative, maybe that meant they didn't have
right. Oh, how many times I've had that conversation.
Yeah, exactly. Incredibly important. But, from my perspective, from our perspective, we have vast knowledge of lots and lots and lots of patients. We are very fortunate to have clients who want to know, they want world-class medicine. They want to know how to prevent disease for their pets, how to take care of their pets. And it allows us to be able to work with the information we're getting, work with our partnerships to answer, some of the things we don't even know yet what those questions are.
Mm-hmm.
And then having the ability to say yes and to be very, I'll say quick. We don't have many layers of hierarchy to go through. There's an idea that comes up, and I work with great people, and my job is to say yes as much as I can and make sure that we can do something that will contribute back to our profession and to patients and veterinarians and allow us to be able to serve our clients and patients better.
Absolutely. Absolutely. Well, this is such a cool study in and of itself, just at face value there. But I love that we were able to dive into so much of what was behind it and people working together really for all the right reasons and showing the best of our profession. So thank you to both of you for coming on and discussing this. Any final thoughts you want to share?
Well, I mean, I appreciate the thanks, but it's not us that did the work. I mean, so let's just be honest.
But you're up on the stage and you're talking about it. Well, we'll put you as the face on it right now.
I mean, Maria and I's job is to get the right people in the room and then get out of the way. I mean, that's what we do. And so, from a standpoint of, I feel like I have the best job in the world, being able to be around such creative people that have that technical expertise and that have, that curiosity to sort of push that limit. That's the thing that's really, really interesting. And the thing that is the sort of underlying theme, though, is it's got to be practical. It's got to be used. It's got to be able to have a veterinarian and technician be able to be there with a client and a pet in front of them and be able to make good decisions with the data that you drive. And like that, to me, I think is the key point. We can make all kinds of wonderful things, but if people don't use it and it doesn't give them good information, it's not going to matter. And so that's
quickly. It has to happen quickly
that's
too.
true. Yeah, that's true. These days, everything needs to be quick. So yeah.
Absolutely. Dr. Kerl, did you want to add anything to that?
Yeah, it's there are many different things to kind of think about with that, of how do you make sure that what we're doing is a positive contribution.
Wonderful. Well, thank you both for joining me. This has been such a great discussion. Thank you to both of you for being here.
Well, thank you. Really appreciate the invitation.
Yeah, thanks for the opportunity.
This study really shows what's possible when organizations work together, share resources, and put the focus on advancing knowledge for the benefit of pets and their owners. Huge thank you to Dr. Barr and Dr. Kerl for joining me to share insights into this fascinating project and the impact it's had on our field. Big thank you to VCA and Antech for making this episode possible. And of course, thank you to everyone who tuned in to listen and everyone who joined us live at the VMX Soundstage. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcasts to help other veterinary professionals like you find this and other great content we try to put out there. For more episodes like this, you can click on the Education tab on the VetFolio website or find us wherever you get your podcasts. We're always eager to hear your thoughts and ideas for future episodes, so feel free to reach out to me at dvm@vetfolio.com. We can connect on Facebook at Dr. Cassi DVM, or you can follow me on Instagram at dr.cassi.dvm. And remember, if one animal is better off because of you today, it's a great day.